we recognized that we needed consistency across the organization. We need something that was reliable. We switched to DAX Copilot, not only for its speed and accuracy, but also because it's agnostic to any EHR. It can be used for our inpatients, outpatients, pediatrics, anything that we threw at it, it was working for. So the benefits that we're seeing with DAX Copilot ranges from qualitative aspects, such as the physicians feel like there's less of a cognitive burden on them. They're able to get out of the facility quicker and get home to their families. But we're also seeing a quantitative measure as well. We're seeing a reduction in documentation time in some cases, but really we're seeing this RVUs that were being left on the table are now being captured. In regards to looking at quality of care, it allows us to capture things in the note that may have been missed and also create a very comprehensive note that can be passed along to other physicians within the organization as well to create a holistic picture for the patient. We started with primary care and pediatrics. We wanted to see how it worked and see if it was something that would be a good fit for us. Needless to say, it is a fantastic fit, and I have specialists knocking down my door constantly asking when is it their turn to start. The benefit to the organization as a whole, and also from an administrative perspective, is I have happy physicians. Happy physicians create a happy environment with happy patients. Often I ask myself, if the physician is taking care of the patient, who's taking care of the physician? And that, from an administrative standpoint, is what we're here to do. And DAX is the perfect solution for that. The impact to the patients have been phenomenal. Not only are the patients able to view the records sooner because the physician's able to close that chart, but it allows them to connect eye to eye and person to person with their physician again. The financial benefits that we're seeing from DAX Copilot has been really positive. What we're seeing is an increased RVU to encounter ratio. We're also seeing physicians take on the aspect of, well, if I have an add-on for the day or a double booking, I may have turned it down before, but now with DAX Copilot, I feel confident in my abilities to take on that additional patient without stressing out myself or the rest of the team. If I had to describe DAX Copilot in one word, I would simply call it a game changer.